It's interesting that virtually every imaging modality that exists, especially for the heart, has utilized contrast agents, and that's been done since the earliest cardiac imaging. But in ultrasound, we traditionally have not used that, and we focused on tissue, and we haven't been able to see the blood pool quite as well. Well, the advantage of contrast agents are that when contrast agents are used with ultrasound, they enable us to see the entire blood pool all the way out to the outer borders of the cavities. And in doing so, they enable identification of borders of the cavities and even of masses that are contained inside, so that contrast agents really have the capability of taking an incompletely defined anatomy of the heart and making it completely defined. Now, I've had a couple of instances of patients where the use of contrast has made an enormous difference. I can think of one patient who came to the emergency room with chest pain and an abnormal electrocardiogram, was rushed to the cardiac catheterization laboratory where the coronary arteries were found to be normal. Now, this patient was on their non-contrast echo, thought to have a wall motion abnormality. After the catheterization, we repeated the echocardiogram, giving contrast, and lo and behold, the patient had apical hypertrophic cardiomyopathy. And with the contrast, we could see the true borders of the septum, and we learned an important lesson from that. It's not exactly what you don't see that's critically important. It's what you think you see that just happens to be wrong. There was another patient who came down as part of a research study, and as part of this study, after their regular echocardiogram, they got ultrasonic contrast, and lo and behold, we saw a big blood clot in the left ventricular apex, a thrombus that was missed completely on the regular echocardiogram, seen very well after contrast, and clearly an indication to give anticoagulant drugs. So that the contrast echo has done a number of really important things that are clinically valuable. One of the issues or limitations of echocardiography has been reproducibility. We know from examination to examination there's often some variability in studies, and in fact when echocardiography has been compared to magnetic resonance imaging to look at left ventricular size and function, the magnetic resonance imaging has been more reproducible. Well, in subsequent studies, one can observe that in fact using contrast and substantially enhances the reproducibility of echocardiographic measurements. And so in an era when precise measurement of the ejection fraction and cardiac volumes is so important in determining therapies such as biventricular pacing resynchronization or the implantation of cardiac defibrillators, precision of echocardiographic measurement is very important. Reproducibility in following patients, if seeing their cardiac function is deteriorating, becomes very important. Reproducibility in terms of giving an intervention, giving a drug or some other intervention to determine whether or not it's been successful is very important, and contrast echo is really of incredible value in assuring the reproducibility.
Love it. Excellent. And do you feel that contrast has any benefit to the overall healthcare system?
So one of the other obvious advantages of contrast echocardiography, contrast agents, is in rescuing echocardiographic studies that are just technically inadequate. And there are clearly a number of those variously reported at perhaps 10 to 15%, where at the end of the study you really have not gotten an answer to the clinical question. And contrast echo often can provide that answer, and it can rescue what is otherwise a non-diagnostic study. And the importance of that to the patient, of course, is obvious. They get a diagnosis. The importance to the healthcare system is that, number one, the expense for the echocardiogram is not wasted, and number two, some subsequent study or intervention which might be applied is avoided, therefore saving the expense of that intervention. So this is one of those unusual situations where contrast echocardiography can benefit the patient, benefit the physician, and in fact benefit the healthcare system as well.
Do you have any thoughts about the issue of radiation?
One of the other potential benefits of contrast echocardiography is in the avoidance of ionizing radiation. Now, although it's very difficult to scientifically relate radiation dose to adverse events such as cancer, for instance, it's generally agreed by everyone that there is no established safe dose of radiation. So that if you could avoid all radiation, that would clearly be optimal. It goes without saying, therefore, that a test or an imaging procedure that avoids the necessity for ionizing radiation would be of enormous value to the patient and to society in preventing adverse events.
In your experience, do you have any comment on the current status of boxed warnings in terms of their relationship to the current status of research, and any thoughts about what you think an appropriate course of action should be?
Clearly, there's no test in medicine, there's no drug in medicine that is totally free of side effects. And as has been pointed out, even water can kill you if you immerse your head under it. So that we have to begin with the concept that there is nothing we do in medicine that's 100% free of adverse effects. In that context, we acknowledge that very, very uncommonly, one may have allergic reactions to an ultrasound contrast agent. However, the key is not that there are some very infrequent, usually modest side effects from contrast echo, but rather look at the risk-benefit ratio and the benefit in providing a diagnostic test, and one that avoids additional testing more than overcomes the minimal risk to these very, very rare side effects. And in fact, I think the literature that's available on that really shows that in hundreds of thousands of patients that contrast echocardiography is extremely safe.
Do you have any comment or
You get a snack in a second.
I know, I have so many questions. Do you feel that boxed warnings deter use?
One can ask whether boxed warnings actually deter the use of contrast echocardiography. And for me personally, I have no knowledge that that's the case, but common sense would dictate that if one is uncertain about whether to apply an intervention and there's a warning on that product, that it may be of adverse effect to a patient, that one is likely to not apply that intervention. So common sense would dictate that whenever you have a black box warning, you're probably likely to just decrease the application of that intervention, and that's likely true for contrast ultrasound.
Is there anything else you would like to say that you think you've done a fabulous job with?
The only thing I was thinking, you guys, and I gotta let you get your snack, was, you know, what's the impact on patients that this is having here in the U.S. during this period of the black box warning? Are
You
anything
know,
patients?
that stuff is speculative.
Yeah,
You
all right,
know,
well,
and
let's
so
not worry about it.
it's hard,
Yeah.
and you get to a line where you know, it's opinion and not fact. It seems reasonable. It seems reasonable that a black box warning would deter use,
Yeah.
and
That's the
you know, there was
purpose.
clearly some evidence that after the first black box warning came out, that a lot of hospitals just stopped using it because of the potential for litigation. But when you get into how has it hurt patients,
Right.
then
Yep.
it's speculation.